Welcome back to OpenLine. I'm Carrie Sharp here with Dr. Jacob Kaslow, a pediatric pulmonologist at Vanderbilt Children's University. That's a mouthful.
Yeah.
But we are glad you are here tonight. We are talking about the very serious topic of teen vaping and the dangers with it. We have our first call tonight. Leanna is joining us. Hi, Leanna.
Hi.
Go ahead.
I would like to know if vaping affects the fetus, and I'd like to hang up and listen.
Okay. Thank you, Leanna. I appreciate it. Go ahead.
So, yeah, that's a great question. There are some studies that are starting to look at that. As a medical community, we don't know the exact effects as we do with tobacco, marijuana, alcohol, some of the other narcotics. We just don't know the specifics. What we do know is that when you inhale these metals, chemicals, flavorings, and these other compounds, we do know that they enter the bloodstream. We do know that some of them can cross the placenta. So we do know that the fetus can see some of them. The difficulty, as I kind of mentioned earlier, is that this is so new. There aren't that many adults who are admitting to vaping who are then having children. Not as many as who were smoking previously years and years ago, who are then having children, and we can see the pattern, because to a certain degree it becomes pattern recognition, right? A group of kids or a group of infants, newborns, have similar features, and we can start piecing together the patterns. Same with the cancer connection with cigarettes. We kind of piece it together. With this, we just don't know at this time. The data suggests there is some effect. What that really looks like is yet to be discovered.
And the sad thing about that, it's always having to look back, usually years later, after a bit of a generation has already been impacted without the knowledge. And the big part of this is that is so frustrating is when e-cigarettes hit the market, it was often advertised or sold as a way to quit smoking or cut back on cigarettes, and it was a healthier option. But I read, and you told me as well, the nicotine amount that you get from vaping is more than sucking on a cigarette.
Yeah, so I'm glad you brought that up. So let's talk nicotine for a second. So like I said, so I'm a pediatric pulmonologist, so I'm a pediatrician by training. So I really care about the young adult, the teen, the adolescent, and when we talk about that, we talk about a developing brain, right? We know that adolescents are going to make, let's just call them interesting choices.
Yes.
And so we know that the prefrontal cortex, so that's the part of your brain that is involved in executive decision-making, behavior, sort of complex decisions, we know that this is when it's growing the most. This is when it's really developing. And we know from certain models that when nicotine is introduced to the body, it changes that neural signaling. It changes the function and the structure of those neurons, which can then have the downstream long-term life effect of potential addiction, so increased addiction, substance abuse, memory and learning issues, and we're not talking significant delays, but enough that you're taking something away from what you had or where you were headed. And so when we give young adults and teens this, any amount of nicotine, we know it's doing harm. So in any traditional cigarette, there's about 1 to 2 milligrams per milliliter of nicotine.
Okay.
And that's one cigarette. When you're talking about these pods, and specifically some of the JUUL pods and some of the others, you're talking about upwards of 40 to 50 milligrams per milliliter.
40 to 50?
So the JUUL labs have about 43, as what they say. And all right, so when they initially came out, they were all about 1 to 2%. The e-liquids were 1 to 2% nicotine. That was as they initially started, these were the safer alternative. This was, here's your cigarette smoker, and we're going to transition them to this safer alternative. So we got to put some nicotine in it.
Right.
And I can see where that connection can be made. They would use this 3% nicotine for the 2-pack-a-day smoker. So the individual I've been smoking for 20, 30 years, I cannot quit. I smoke 2 packs a day. Like, this is just, you need more nicotine to make that switch.
Sure.
When JUUL and some of these other more popular brands for young adults came on the market, their lowest percentage was 3%. So they sell a 3 and a 5%. So what 16-year-old is smoking 2 packs a day and can't quit and needs a 3% nicotine? It just doesn't add up. Now you have the ability to add nicotine to your e-liquid. There's nicotine salts, so there's quicker absorption and a faster, what we call like a come down. So you would take a puff and your nicotine levels in your body would rise and you would get this euphoria, you know,
Sure.
and then you hit this high peak and then you drop quickly.
So you're ready for another one.
Exactly. Yeah. So now you're like, oh no, I don't feel great. Wait, let me hit it again. So you can go through a pod in a day. A pod is the equivalent of about 41 cigarettes.
41.
And so you're getting that much nicotine. You're getting the equivalent of essentially 2 packs of nicotine a day if you use a JUUL pod.
Which goes back to when you said, when you started first seeing cases and parents would say, yeah, we know about this, and they were okay with it because they thought it was keeping their kids off cigarettes.
Absolutely. And you know, at that time, you didn't need to say it contained nicotine, it was harmful. They didn't have these labels, they didn't have anything. So parents I saw cases with my own 2 eyes that, yeah, I bought it for my son or daughter because it's safer, and if they use this, they're not going to probably smoke, which we now know is not true. Young adults who smoke e-cigarettes are more likely to transition to traditional cigarettes. But they were buying them and saying, it's just water vapor and some flavor, there's no real harm. And, you know, naively, I think most of the medical community just didn't know enough to say otherwise. I think we all suspected it. You know,
you put 2 and 2 together, what do you get?
I mean, as a pediatric pulmonologist, as a lung doc, if you're not breathing fresh, normal air, you're not breathing the right stuff. And so I think we had our suspicions, but we didn't have anything to back us up. We didn't have any science behind it.
Yeah. Let's jump back to the phone lines real quick. Helen is on the line. Helen, thank you for your patience. Go ahead. Helen, go ahead and listen to your phone. You can turn down that TV. I can hear it in the background. And then go ahead with your question when you're ready.
Yes, I have a question.
Okay, go ahead.
I
know you're distracted by the TV in the background, but go ahead, Helen.
Okay. My 16-year-old granddaughter has been vaping for the last year, and we've tried to keep her off of it, but we can't. Every time we take them all away, she gets them again. But she had a spell where she had a sore throat, and her stomach was hurting her all the time, and we brought her to the Vanderbilt Children's Hospital, and they scoped her, and they said that the lining of her esophagus and her stomach and all was irritated and was inflamed, and she'd been missing school because of this, because she says her stomach hurt so bad that she couldn't. Could this also be caused from the vaping?
Okay, Helen, I'm going to hang up on you so you can listen to your TV and get that answer, okay? Thank you for calling in. I'm so sorry you guys were dealing with this.
Thank you.
You're shaking your head.
Yeah, so it's always difficult to say exactly causality.
Sure.
My suspicion is that this was secondary to vaping, or at least due to the exposure, and for a couple of reasons. So, of this, you know, we had was that outbreak in Wisconsin and Illinois that really got all of this started about 3 or 4 months ago, and they published all their information, which was extremely helpful because before it was just scattered reports across the country. And what they found was about 81% of their patients had GI or gastrointestinal symptoms, whether that be nausea, vomiting, weight loss, things like that, sore throat. And so I do think that there is a relation. So there is something called vegetable glycerin, which is in the electronic liquids. It's in almost all of them. It's called a carrier, and it's what carries the flavoring, and it also gives the big cloud, the big puff. And glycerin is something we would give if, you know, you have an upset stomach, and it sort of can help you go to the bathroom.
Right.
But if you're inhaling a lot of this, I suspect that it's also irritating your GI system. And when people are inhaling, it's not just going into their lungs. I mean, when you go like this, you know, some of it sits here, and then everyone swallows, and then it's going to go into your esophagus. And these, like we talked about, these are chemicals. I mean, it's not that they're just little water vapor and it's no. These are chemicals, and now you're swallowing, and now it's sitting in your esophagus, and as it goes down, just coating, sitting in your stomach. So I'm not overly surprised at this. I mean, I do think that this would be an atypical presentation, certainly, but I absolutely think that this could be related to vaping.
So if you're Helen's doctor for her grandchild, I think it was, maybe the connection wasn't made at first. Is this something that she needs to go back in and say, what about vaping and what about these symptoms? Is there something else that needs to be done even if her child is feeling better?
So if I think the danger is that they start feeling better and the connection between the vaping and the symptoms is not made.
Okay.
So I think if we start to get better, I think most people's tendencies are, oh, I'm better, and they keep vaping, which may be the case that you're just waiting for the next time for it to happen. And I think this goes back to like the nicotine, and they mentioned that, oh, she keeps getting it, and I don't want to sort of speak for her or the family, but we see this all the time where families say, oh, I took it away, but 2 weeks later we've got another one. And we've heard kids, young adults, and I say kids, but these are really 12, 13 at the very youngest, but more 15, 16, 17, 18. They'll say, when I leave the house, I check for my phone, my wallet, and my JUUL or my vape. Because I can't be, I can't be without it. And I think that's the nicotine talking.
Sure. It's just like that pack of cigarettes in your pocket from years gone by.
Exactly.
Let's get to Joe real quick. Hi, Joe. Go with your question, Joe.
I just have you there?
Yes, we are. Go ahead.
Yeah, I have a question for the doctor. We have a Department of Alcohol, Tobacco, and Firearms. Everybody's aware of it. This nicotine that they're getting, I guess my question is they're getting it only from tobacco? Is that where they're draining the nicotine from and then putting it into a vapor? If that's the case, why isn't the Department of ATF like monitoring what's going on in America? And why is it, do you think it's safer if we would have just, if ATF bans all e-cigarettes and all vaporing and goes back to just the traditional cigarettes, would that be safer? That's my question.
All right, thanks, Joe. It's an interesting question. I guess it kind of puts you in a dilemma too, because people are saying, are cigarettes safer? And I can't imagine that doctors for years ago have been trying to fight
this. That's fair. So I think there were two questions there. Right? One was kind of where the source of the nicotine is coming from, and they're not all coming from the tobacco plants. Some of these are being manufactured in labs. So when you have nicotine, it tends to be a salt with ammonia, at least in cigarettes. And what we're finding is that the nicotine is being salted or creating salts with other compounds. And when you add the nicotine salts that are being created in the lab, and they're being attached with different compounds, and compounds that are, like I said, increased absorption, so that higher and then the lower. So it's not all from just tobacco plants. I don't know why the ATF hasn't become involved, and it might be because it's not tobacco, it's nicotine. I do know that this falls under the FDA. The FDA has used the deeming rule back in 2016 to kind of take jurisdiction over this, although they've done nothing up to date. But certainly these are ways to deliver nicotine. And one thing I like to kind of say is that they're not electronic cigarettes anymore. I mean, these are nicotine delivery systems, is what we call them. So we call them ENDS, so electronic nicotine delivery systems. Okay. Because they're not e-cigarettes. I mean, initially they were. That's what they looked like because they were meant for that transition, right? You wanted something that looked like it, the feel, and they really were marketed towards the smoker. Right. Now, you look at how sleek they are. That's not who they're going for. These are ways to get people, specifically, I think young adults, but even young 20s, addicted to nicotine.
Because you mentioned this too, we've seen cigarette use plummet.
Absolutely.
And now we're seeing e-cigarette use, or ENDS, skyrocket.
Yeah. And so we know from National Youth Tobacco Survey and Monitoring the Future, which is a study out of the University of Michigan, and they've been looking at traditional tobacco, most narcotics, alcohol. They've been looking at this for years. And if you look at the trends, the amount of young adults, so people in high school, middle school, the people using cigarettes, it's been doing this. It's just going down. The disapproval rating of smoking cigarettes is going up. So people it's not cool. It's just not there. Then when you look at electronic cigarettes, and it does this. So in 2011, they estimated about 1.5 of high school students had used electronic cigarettes. In 2018, that was about 20%, so 1 in 5. Wow. Last year, the 2019 numbers came out a week or two ago. It's about 1 in 4 now.
1 in 4? Wow.
That's not even the scary stat. I think the scarier stat is middle school. So in 2018, 1 in 20 middle schoolers were using electronic cigarettes.
My goodness.
We've seen a patient at Vanderbilt who came in for lung injury. We thought this is kind of an odd presentation. asked parents to leave the room. This individual was in the end of middle school, high school years. We asked him, is there any vaping history? He said, yes, but I stopped. So he said, okay, so how long ago did you stop? Well, I stopped a year ago. And we said, oh, how long did you vape? I vaped from 5th to 7th grade.
5th to 7th grade.
And it's just shocking. Wow. Every time we come across these patients, it's just shocking every time.
Yeah.
And so I guess going back to the nicotine, is it Joe?
Yes, Joe. Mm-hmm.
Joe's second question. When my concern with banning these outright is that the black market will fill that void.
Yes.
And so I think that's what we're really struggling with, not just as a medical community, but the legislature, politicians, the American Academy of Pediatrics, the American Thoracic Society, the American Lung Association. All of these, I think everyone's struggling as to what's the next step? Because I think if we ban them outright, well, people can make e-liquids. Anyone can make them, and at this time, without FDA regulation and approval, anyone can sell them. Anyone can make them and sell them. There's no oversight. It's the Wild West. So if anyone can make it, you really don't know what you're getting. Yeah. I mean, to some degree, regulation means standardization, testing, safety. I mean, we know from case reports that some of the pods have fungal elements, bacterial toxins.
That you're sucking into your body.
Exactly. You're just inhaling, imagine taking a dropper and just dropping right into your lungs. And so I fear that it would drive a black market industry that would be far more unsafe than what we're really dealing with.
And speaking of the black market, and we've been reporting on it, especially in the last few days and today with this death here in Tennessee, but as the component of these illnesses and the deaths that we're seeing, even the state health director said today that most of these, he said, look to be from THC vaping, that has that THC component in there, the component from marijuana. And so I think that it's important to know that, but then also it may give folks permission to discount vaping nicotine.
I think that's exactly right. My fear with the CDC coming out saying that a lot of this is THC and a lot of this is black market is that then the people who are not maybe using THC or not getting black market thinking that it's safe.
Yeah.
And certainly that hasn't seemed to be the case when you really look at the numbers. I mean, about 75% of the people admit to using THC at all, whether that's right before, whether that's within that 90-day window. So you could have vaped THC 80 days ago and developed problems today, and you would still count with THC in that. And so when you think about 75%, well, there's 25% of the people that doesn't explain. And so now there's about 1,200. There's actually a little over 1,300 confirmed cases. Well, now you're talking 200, 300, 400. Where do you explain those?
Right. And I wonder, you said, there's that 90-day window when things get classified. If someone says, well, I vape and sometimes I do THC and sometimes I just do nicotine, are they going to be lumped into the THC category?
Exactly. And I think they would if you're looking at that classification. I don't know exactly how the CDC does it, but if they ask it and you sort of check your box when we as providers report it, I believe, yes, it would get lumped into that.
So maybe that explains the big number, or it's a little skewed.
Yeah, and I think the scary part is, so they did a study a couple years ago, and they found that 63% of young adults ages 15 to 24, 63% did not think that JUUL contained nicotine.
Oh, wow.
So if I were to ask a young adult, an adolescent, do you vape nicotine? They would say no, because the majority of them don't think it contains nicotine. So the companies have done a fantastic job of really hiding that.
Yeah.
But it also highlights just how much misinformation and misunderstanding there really is about what's in them.
All right, we have to take another quick break. Ezra, I know you're on the line. As soon as we come back, we'll get to your call. Stay where you are.